or from evicting any staff from the hospital premises.
Now, it is no secret that healthcare services globally do not come cheap. You may know at least a family that has been driven into poverty as they spent all they had on a loved one's healthcare bills, which many such incidents, Makueni County Government has now taken the mandate to fulfill a constitutional right to its citizens that is provisional of the highest attainable quality of healthcare affordability. Dr. Makueni with that report.
In what seems to be a bold step, Makueni County Government has taken the global call to provide universal healthcare coverage for all and localized it to benefit the estimated 200,000 households resident within the county.
Everybody in Makueni should be on this program, and everybody means anybody who is resident in Makueni for 6 months is eligible for this.
A plan that targets to provide healthcare at no cost at point of service delivery to the citizens of Makueni within the public health system or the public health hospitals.
With this program, Makueni County is addressing the affordability of healthcare, one of the 3 pillars to attaining universal health coverage.
My mother is diabetic. And previously, before I registered her with the universal card, I was taking her to private hospital. And it was very much expensive. The sugar testing, I was paying around 2,000, 3,000. And I was taking her for around after every 2 weeks.
We also had cases, actually many cases, of people who went to private facilities, went to national facilities, including Kenyatta, and they couldn't pay, and they were detained. And of course now again the relatives came to us asking for us to pay, to help them pay for medical services. We had many cases of people selling land, of the people selling their cattle, so that they would be kind of impoverished.
These stories are similar to those of many other Kenyans who have been driven into poverty due to catastrophic out-of-pocket expenditure on health.
Since the beginning of this program, we have even seen the health-seeking behavior changing in the county, because right now there is no financial burden that stops our citizens from accessing the services in our hospitals, as long as they have membered themselves with the program.
These services include all outpatient and inpatient care as prescribed, including diagnostic tests and medication.
We did so well so that we had therefore the infrastructure to support free medical services in the major hospitals where actually people used to pay. We made sure that, we had theaters, we improved the doctors and the nurses, the health personnel.
This would be in keeping with the second pillar towards universal healthcare coverage, that is, availability and quality of healthcare services.
We implement a fee for service. So every client who comes to the hospital, they are able to be treated. They are given a receipt, and the receipt is billed to the county government or to the UHC fund, which now we reimburse to the hospitals for their operations.
The program has even extended to cover the first 10 days of mortuary bills, just in case a loved one passes on in our hospitals when they are being treated.
They pay 500 shillings. These 500 shillings get us for the principal contributor, the spouse, and children below the age of 18 years. And this should be able to give an annual cover for the household.
The case of Makueni has demonstrated that this is not a pipe dream. It can be done. One needs to make sure that there are facilities, there is staff, there is equipment, and then there is a reliable budget. We are happy that many counties